I'm Colleen Kelly. I'm a gastroenterologist. My husband's also a physician. He's not here tonight. He's an ICU doctor. We definitely disagree on a lot of things, but it's our 21st wedding anniversary. So I also have 3 children, Providence Public Schools, so I'm kind of speaking as a physician and a mother. And I'm really happy to be here tonight to see so many people who are interested in this. And I want to clarify up front, it is a little scary for me. I was going to say warned, but I am not here as a representative of my employer. I'm not here a representative of Lifespan or Brown. Nothing I say is the opinion of my employer. This is all just from me, from my experiences. And I don't have a lot of data. I don't have a lot of slides. It's just really, from the heart, what I witnessed over this last 3 years that really, really affected me. I will tell some anecdotes. All of this is HIPAA compliant. I've obscured some of the details so that no patient is recognized. So we have a lot to rage about, and I've spent the last 3 years, you can ask my kids, my husband raging about a lot of things, my kids being out of school being one of them. But as this is all kind of, starting to be in the rearview mirror, I want to try to move towards some type of positive steps. I want to channel that rage into things that could potentially, help people in the future so that this doesn't happen again. And some of the things that I witnessed with patients were really, really upsetting. And we felt as healthcare professionals, it was very tough. It was tough to reconcile giving good care and taking ethical care of patients and things that I felt like were the right thing to do with this other approach that I really knew in my heart was wrong and was really hurting people. And that disconnect for myself and some of my colleagues, when we talked together, was really tough. So I want to kind of focus a little bit on what was done to patients. And not all of this. Most of these stories are going to be after that initial scary couple of months of lockdown when we thought the zombie apocalypse was hitting. Okay, so this is all stuff 6 months in, all the way up through even mid-2022. Okay, so I had a patient, I think we think about what was done to patients in the dementia care setting. These people did not know what was going on. They were isolated from family members. Many of the nursing homes did not allow visitors for long, long periods of time. I took care of a gentleman who had moderate dementia, hadn't seen his family in over 6 months. A son was helping me, who not allowed in the hospital, but helping me interpret the patient's complaints on the phone. And then when I took the phone back from the son, he said, "Oh, he's just so confused. He's asking us, he thinks we all left and went back to the old country, and he's asking us to come get him." And that really brought tears to my eyes, how this man was filling in that missing piece of his family. I saw a wife separated from her husband. She had been hospitalized early in the pandemic and then had spent a long, long time in rehab, but due to complications wasn't able to go home. And he was in this bureaucratic hell trying to get her home. I saw her in the office alone. We were able to conference in with the husband on the phone and listening to them. They'd been married 50 years, hadn't seen each other in over 6 months, saying, I love you, I miss you. These were just really heartbreaking stories. I saw a patient who had lived in one of the really hard-hit nursing homes early on. She had actually had COVID and survived. She spent 1 year locked in her room, okay? She, not exaggerating, her sister wasn't allowed to visit. She would have food trays brought in 3 times a day. She was losing her mind, and she came to me to a follow-up appointment where we had to see her sort of isolated from the rest of the patients down in this room on another floor, and she said that you start to hear voices. You're alone in this room for a year, you start to go crazy. And I said, well, can't you complain? She had a lot, her mental faculties. I said, talk to the administrators at the nursing home. And she said, no, they don't listen. They say they're doing it to keep us safe, and they really, or would threaten to, kick them out. In hospitals, this was happening for a long, long time where patients weren't allowed to have visitors. We know the stories of, people dying on iPads, obviously, but the other things I saw, people who really needed their family members at their bedside for support, for help, for communicating with the health team. I saw a very, very tragic case of a young woman with metastatic cancer, and she was dying, and she's in the hospital as a complication of one of her treatments, and her husband wasn't allowed to be there. I saw a person who was going to be taken off life support, a younger person whose children had to say goodbye by recording a message to their dad that was held up to his ear as they remove life support. We all have these stories, and all my colleagues have these stories. And I'm sure many of you in the room have friends that were in nursing homes or affected by this. Colleagues, and we were all struggling and trying to believe that the people who came up with these policies were doing it because they thought they were doing the right thing, and they thought they were saving lives, and they thought they were being careful. But it was hard to figure out who was actually, where the edicts were coming from. Was it coming from CDC or the Department of Health, or was it infection control? And I would question, and I tried so hard. I would ask, I would email the Department of Health. I wouldn't get responses. I would ask hospital administration, and everyone, it seemed to be just very vague. Nobody wanted to really take responsibility for these policies, and they were all basically to keep people safe. Or when I asked about visitors, they said, well, the visitors can't be fit tested. So if they can't be fit tested, it's not safe for them to be here in the hospital. I had colleagues and friends, people saying that you felt like you had to try to figure out a way to wiggle around the rules just to be a good doctor or a good nurse, and to try to like help a patient who maybe the policy was they're not supposed to have visitors, but you knew that they needed someone there, and feeling like you have to worry about are you going to lose your job, or are you going to get in trouble trying to do the right thing. So, this was very dystopian. I felt that, we know solitary confinement in a prison is cruel. You're not allowed to keep somebody away from, certainly locked in a room for a year. It was heartless, and I really just don't want to see it happen again. So, how does this happen? I don't know anything about making laws or what the current legislation says about patient bill of rights. I know we have a patient bill of rights, but I think it certainly needs to be amended so that something like this can't happen again. And I think we need to think, there has to be obviously policies in a hospital. You can't have dogs and babies running around and 400 people visiting, but you should have a policy where people can have a support person present. They can't be locked away from family members. You shouldn't be highly restrictive, pick 2 people who can come to the hospital the whole time you're here, whether you're here for a month or what, where family members are having to decide who gets to say goodbye or who gets to be, see a parent. So I'm glad to see there's so many people here tonight. I'm glad to see that there's legislature people and there's lawyer people and other medical kind of people in the medical community who are interested in this. This is something I want to work on, help in any way I can to try to potentially make a law, just so that when this happens, we don't have to rely on, just rules coming from various bureaucratic settings where we really don't know. We'll be able to have a plan ahead of time. What is the right thing to do? What is the right way to take care of patients? And I feel especially bad for the people who did die alone and died alone with iPads. And I thought about even finding an artist or someone who would want to make a monument to them, have a GoFundMe and a monument to the people who died alone, to the people who died on iPads with their names on it, because these people were denied their humanity. They were denied something that we all think about how we want to die, and nobody's death story is alone in a hospital room. And so it was a really tough time. I try to forgive, because I know that a lot of people really felt like they were doing the right thing, but. I thank you guys for letting me talk. I don't want to talk anymore because I know there's a lot of other people that have things to say, but I hope to talk to some of you afterwards as this winds up. So thank you very much.